The Journey program on UBC TV.
Hello viewers, my name is Anna Nabulia. I work as the Deputy Director of Uganda Youth Development Link, and I've been with UDEL for the last 25 years, working with young people that are living in the informal settlements and that have been in one way or another suppressed with either using drugs and substances, those that are in situations of sexual exploitation, and those that have been trafficked or in situations of committing crime. UDEL was started in 1993 by a few professionals. One of them is still actually the director for UDEL, that's Dr. Kasirye Rogers, one of the founder members of UDEL. The initial founding of UDEL was basically looking at children who were living on the streets and abusing drugs. But as we were moving into the actual implementations of interventions and interacting with children who were living in basically Kisenyi on the streets, we realized that there was more to them just being on the streets and using drugs. We also realized that there was lots of sexual exploitation of these children. Some of these children had been trafficked. Some of them were teenage pregnant parents, and that is now the boys and the mother and the girls. Some of these were adolescent parents already. We looked at aspects of sexual reproductive health. So we widened our scope to now starting to address not only alcohol, drugs, and substances, but we also started to address sexual exploitation, sexual reproductive health. We started looking at child labor. We started looking at aspects on youth economic empowerment, because the biggest push factor for them was as a result of them coming from backgrounds that were impoverished, or they couldn't find income to survive. So they were trying to do these odd jobs, but also engaging in transactional sexual relationships to try and find some form of survival. Why Uganda Youth Development Link? This is because we wanted to empower young people, but ensure that every young person within Uganda is having a good quality of life through the socio-economic empowerment interventions that we provide. But we wanted to also do a lot of prevention science work, evidence-based prevention work, so that we don't see very many young people ending up in situations of being on the street, in situations of abusing drugs, in situations of sexual exploitation, or in situations where they are being trafficked in one way or another, just because they are not resilient, or they do not have the life skills they need, or they are not economically empowered to ensure that they are living a normal and a good life. UDEL's vision is basically looking at a good quality of life for all young people within Uganda that is free from exploitation. Our mission is basically aimed at transforming the lives of vulnerable young people through economic empowerment, but also building resilience of young people. We aim to do a lot of socioeconomic empowerment through vocational skills training, financial literacy, equipping them with business skills as well, but also entrepreneurial skills. And then we are also looking at, in that socio-economic empowerment, we're also looking at the package on savings and ensuring that they are starting small village saving groups or circles, and they're able to tap into some of the grants that the government has put in place with the skills that they acquired. But we also do a lot of mentorship for young people to either get career guidance and also ensure that they are getting back into either the formal education or the formal employment system. And then besides the socio-economic empowerment, we do social rehabilitation for those that have gone to the extent where they are now starting to abuse drugs. They are facing situations of abuse. So we come in with counseling, we come in with a bigger psychosocial, motivational interviewing interventions that help them bounce back, think about the things that they have faced and all the tragedies or trajectories that they have walked through life, and then starting to reflect on how to now start dealing with those issues and then bouncing back and ensuring that that is not failing them to go on with the futures that they need to have. Under the socioeconomic empowerment, we've done the vocational skills training. We have 4 drop-in centers where young people walk in every day and get a vocational skill. And the vocational skills package is different. We have different packages. We have packages that go from 3 months to 6 months. Those are the long-term skills, the traditional skills like hairdressing, tailoring, welding, plumbing, motorbike mechanics. And then we also have the short-term skills that can take up to 3 days to 2 weeks to learn, which are, like making juice, making jam, making liquid soap, books, candles, that they can learn quickly and start earning money easily, because the category of young people we work with sometimes really need money as fast as possible. They need money for today. They need food on their table this very night. Some of them are looking for a place to stay. And these situations are pushing them into situations of vulnerability. So once we can address that quick money, and actually the short-term skills came in as a result of COVID. These were learnings that we got from COVID-19, where young people were not able to survive because they didn't have small skills like making pilau, like, making just sausages or roasting chicken on the roadside. So we brought in these short-term skills to now complement the long term, but also ensure that they're getting quick money. Now, besides the economic empowerment, we also offer brief interventions on counseling. We do family reintegration, where we try to trace the families for those that have been trafficked and those that are in situations of staying on the streets and have lived out of their families for long. We trace their families and try to renegotiate, reintegrate them back into the families. For those children that were just stubborn and run away from home, we try to intervene with the families and mediate that session and also support that. We also work a lot with partners that help us with the access to legal aid for those that require legal aid. And then we have quite a vast number of partners, including government and private hospitals, that help us support linkages to sexual reproductive health and rights services, including HIV testing, STI testing, empowering them with life skills and knowledge on how to stay safe and not to engage in risky behaviors that could expose them in one or another to HIV and other vulnerabilities. How do we engage with the parents? It is interesting. The minute we get into contact with this young person the first week, you do not see the parents. They are basically on their own. We've either gotten them from the bars, the brothels, sometimes on the streets, sometimes they are living with friends. So you see just that social network of friends that they are living with that time, the managers of these entertainment places where they are staying. So, but after we interact with them for about a month, then we start seeing the parents showing up, because now they are seeing their children are getting back to a right path. So the parents start showing up. We also do home visits where we go and try to trace the families, but also interact with them, get their consent, but also ensure that they are part of the process of change for this particular young person, and they are supporting them even after they leave the UDEL drop-in centers or the UDEL transitional shelter. So that takes me now into how we work. We work through drop-in centers. These are rented spaces within the informal settlements of Kampala, and we have one in Kawempe, we have another one in Banda, we have one in Mutondwe, Natete area, and then we have another one in Makindye. Those are the 4 in Kampala. And then we have a residential transitional shelter, which is in Masoli, and this one provides shelter, temporary shelter, for up to a year. After a year, we should have either reintegrated you back to your family. If we can't trace your family, then we start building you to live independently or get into the employment system where employers will give you accommodation and then you start living an independent life. So that's how we transit them from the shelter to avoid dependency, but also since we do a lot of brief interventions that are aimed at prevention of some of these vulnerabilities or adversities that they face, then we do not want them to depend on us fully. We want to just put the fire a little bit, and then they can fly, or the flames can go higher and higher. We work basically with young people within the ages of 13 to 24 years. We've seen some that are teenage mothers from the age of 15, 16, 17. So those ones, we have a unique way of working with them. But then our programs go up to 24. Though sometimes we may cross over to 25 or to 12, depending on on the vulnerability of a young person, because we see very many that are starting to abuse drugs as early as 10 years, just because they've been in a setting where they have been introduced, or where the family has introduced them to alcohol and drugs at an early age. So we also tap onto those ones once we come across them. UDEL is a national organization, so we work in the whole of Uganda. And since we are fully donor dependent, our resources sometimes are minimal and can only reach a few outskirts. So our drop-in centers are more in Kampala and Wakiso, and sometimes we also spread a little bit into Mukono. That is where we now have the hands-on. But we move to other areas like Gulu, Bujiri, Iganga, doing lots of advocacy and prevention education awareness campaigns, especially for youth that are involving in crime or violent extremism acts. We do a lot of sensitization there. We also do a lot of sensitization around drugs and substances and alcohol use for young people in other areas of Uganda. So we are not just in Kampala. Why we are in Kampala now, it's because our resources can only put us there for now. But when we do our advocacy work, we spread out to other areas. And when we do get resources where possible, you'll find us in the refugee camps. I think right now we are working with UNICEF in the refugee camps, working with teenage girls or girls that have been exposed to sexual exploitation early, and as a result they've become young mothers. So we're trying to empower them through the Girls Empowering program, and trying to mentor them and link them to life skills and resources within their communities. Government support is threefold. Being an NGO, it's very difficult for you to operate without the government support. And I think this is where UDEL has had a plus. For the last 30 years that we've been in existence, since 1993, we've had very good relations with government, and we've contributed a lot to spaces where advocacy is needed in terms of legislations, enforcement in legislations for children who are sexually exploited, for children who are trafficked. We are also now actively working with other civil society on a platform that is engaging government to work on ensuring that we have an alcohol control bill in place, and also ensure that young people also are able to receive mental health care, because that's one of the aspects we are seeing from our work and what our data is telling us, that many young people are faced with mental health. Actually, we are seeing 44% of the young people that come into the UDEL shelters having mental health issues in terms of distress, anxiety, and suicide is up to, I think, 15%, and that's very high. If we are having young people starting to think about ending their lives because they do not see any hope, or they don't see anyone to support them through the adversities they are going through, then that becomes a little bit difficult. So government has played a very good role in listening to us. Sometimes also when they need consultations or voices of children, they do come and we work together. We have sat on forums with government where they are developing frameworks, and we've contributed to those frameworks that are now guiding most of the work with young people. But also, like I said, the health component. UDEL doesn't work with the treatment part or the care part. So that is where we partner now within government facilities like the health center 3s and 4s to support us with the services on sexual reproductive health or health-related services, especially for those that also have addictions. But also we work very closely with the technical and political wing, especially the political wings within the different divisions and districts are very supportive in mentorship of the young people. They walk into our drop-in centers and provide that mentorship and career guidance and trainings in financial literacy, which we can't do by ourselves. And then they've also provided us an environment where we can work freely without any threats, but also with their support and guidance. And they realize and recognize our work, because we've just completed a youth crime research recently, and government was very keen on understanding what crime trends are happening, and they're doing some interventions already to address issues of youth crime within Uganda. And this is as a result of the research studies that we do, or some of the works that we do. There are very many achievements, given that we've been in existence for the last close to 32 years. we as Uganda Youth Development Link boast of big numbers of young people that have changed. They came out of situations of sexual exploitation. They came out of situations of drug use and alcohol abuse, and are now, some are actually managers in places, some have gone back to school. We've seen young people get formal jobs and get into white-collar jobs, and yet they are coming from situations of street or informal sector vulnerabilities. And I would say from the young people that enroll within our programs, we have 70% success that either get into formal education or formal employment or informal employment and come out of the vices of vulnerability. The other 30% usually is about denial. They are still not sure on whether they need to take this path, so they still need that support. There are cases of relapse that we get. And then we also get some cases that now just get into marriage and then just settle down, and those have just moved on. So we call that also a success. We are proud of having an alumni. We've just recently started an alumni platform that has now attracted over 5,000 young people that passed through UDEL. And they're coming together to support our efforts further, but also support the linkages of young people to other resources. So we have a social network of 5,000 young people that have gone through UDEL, and I think that is something that we should be proud of, because it will also help with our sustainability. But we're also proud that we have good partners that trust UDEL and the work that we do, and the changes that they see in the young people that we've created, or that the young people have helped create with the UDEL team. And I think that is something that we should acknowledge and we should be very proud of. We still have a lot of challenges. I talked about resources, in terms of financial resources to sustain our work, but also when you come into contact with vulnerable young people in situations that I talked about of alcohol and drugs and sexual exploitation, you need multiple resources, because you're dealing with multiple vulnerabilities. You're dealing with a young person who is pregnant, you're dealing with a young person who has mental health issues, is dealing with drugs and substances. This is a young person who needs money as early as today. And sometimes when we design our programs, they do not have that holistic package, or it's not even enough to deal with all the issues that are faced by this particular young person. Now, that is just one who has multiple issues, but there are very many that may come with different issues, and it's very difficult for us to get that. But I'm happy that at least we are trying to sustain where possible. We keep looking, we keep throwing out proposals there, and now we're also happy that you're also coming in and supporting our cause, and I know that people that will watch this will also come together and support the cause. We work with a staff of about 150 staff. 40% are social workers trained from different universities, but the biggest number comes from Makerere University, the Department of Social Work and Social Administration. So many of them are trained professionals in social work and are counselors. So there's a lot of care that they come with from the background that they have taken this particular course. On our team, we also have health workers, nurses, psychiatrists, and midwives that support the work that we do. But we also have, I think 70% of our personnel is the vocational skills artisans that are largely part-time. And those ones support more with the skills building. Now, these other key professionals that work with the social work and psychiatry, we do a lot of trainings, refresher trainings. We have linked them to global platforms where they are now learning different skills on self-care, mental health care, trauma-informed care for themselves, but also for the young people that they reach out to. So we have a wide wealth of care for our teams that we work with. And I know right now we have a universal prevention platform that they can log into and get any kind of support that they need in terms of if they access a young person who is very violent or who may need extra care, or if themselves have received the secondary trauma. You know, sometimes when you're working with these issues, it could also impact you as a person. So we still give them the reflections, we still have those debriefs, we also do the refresher trainings. Sometimes we just bring in counselors and just have days for our staff to just relax and talk about issues that they have seen, the work they have done, and also try to appreciate where we are coming from, but also where they would want to see UDEL go. So besides the socioeconomic and the psychosocial support, our psychosocial support component has a lot of packages that deal with sports, music, dance and drama, and talent identification. We've seen some very nice young people transit and become directors of different drama groups, and have also joined many music, dance and music dance groups. We've also seen those that have transited into football and different kinds of games, because we have a full package that we work with that does sports and life skills as well. Now, for those that complete the socio-economic empowerment, we have partnered with the Ministry of Education, the TVET sector, and we give them that Directorate of Industrial Assessment, and they can access that certification if they want. For those that do not want to take the assessment by Directorate of Industrial Training, we give them the internal assessments for UDEL, but we try as much as possible to link them to the TVET assessment so they can get that accreditation. So they do graduate at the end of the training. Every year we have close to 1,300, 500 girls that are graduating and boys that are graduating from the socioeconomic empowerment. Our future plans is to continue supporting young people, especially in prevention of not many of them getting into situations of vulnerability, ensuring that we are looking at them, the meaningful engagement of young people in leadership, advocacy, but also raising their voices on issues that they see within their communities. We are looking at creating community coalitions that can respond to some of these issues that young people face. Our major focus is going to be on the young person and ensuring that we are empowering them with the necessary skills to survive in the day-to-day Uganda, which has huge numbers of young people that are, you know, desperate and have nothing to do. So we will continue contributing to the socioeconomic empowerment. We'll continue contributing to efforts on rehabilitation. We'll continue also supporting young people develop leadership skills or other skills that they may need to survive and be better persons and get themselves out of situations of vulnerability. UDEL has done a lot of work on alcohol and drugs. Our foundation in 1993 was on alcohol and drugs, and we've contributed to quite a number of forums and discussions and researches on alcohol and drugs. So we do a lot of research on alcohol and drugs. We are a master trainer on the universal prevention curriculum. So anyone who would want to get information on how to support young people or prevent young people from using alcohol and drugs, we have master trainers that have been trained globally that can provide that specialized training to do brief interventions, but also interventions that can help young people come out of situations of vulnerability. And then we also have contributed to, we kickstarted actually the discussion on banning the tote packs. With the Uganda Alcohol Policy Alliance, we were the founders of the Uganda Alcohol Policy Alliance. We are still members of that Alcohol Policy Alliance, but we've had a lot of contributions in there in terms of research, advocacy work, and then we continue to do a lot of enrollment of young people that have been in one way or another affected by alcohol and drugs. We have community coalitions, I think around 3 community coalitions that are now active in Nansana, Nabweru, and also in Matuga, that are closely working with communities. These are community members that have come together and have said, yes, we have a problem of alcohol and drugs within our community, and we want to do something about it. So they've created bylaws on reducing the amounts of sales and the time of sales of alcohol within their communities, what time bars can open. They've come up with referral pathways for young people that have been affected within their community. They have mapped out those high-risk areas where they see alcohol and drugs is very prone for them, and they're doing something, they're forcing their duty bearers within those areas to do something about that. And on these coalitions, you'll find there's a police officer, law enforcement, so at least enforcement is being done, and referral. When they do arrest a young person who has issues with alcohol and drugs, there's a quick referral pathway. Instead of committing them into prisons, they are also supporting them. And then we do a lot of awareness education, prevention education on alcohol and drugs among young people. We have massive campaigns where we've gone to schools, we've gone to communities using drama, sports. We use quite a lot of things that are appealing to young people to educate them on alcohol and drugs. And some of these platforms, you'll actually be surprised that we are using sometimes even social media or just films. We just put up a film show, and then they started discussing, and before you know, they're saying, oh, I think we need to do something about this in this particular area. Or we have seen this particular young person in this particular setting that needs support, so we've used it as a referral pathway, but also to open up conversations with communities and different schools. We work a lot with young people that have been sexually exploited, and we are also seeing a lot of teenage parents, and that is one of the pathways for gender-based violence. And then when you're also working with alcohol and drugs, gender-based violence is interlinked. There's an interconnectedness with gender-based violence. So we are seeing quite a number of, actually I would say around 40% of the young people that come into the UDEL shelters, because we work with close to 1,300 young people every day within our drop-in centers. 40% of those have faced gender-based violence. Physical violence, we are seeing emotional violence, we are seeing actual abuse. We are seeing sexual violence as well. That's very big. Actually, sexual violence takes 60% of all the different forms of violence that we've seen among the young people that walk into UDEL's drop-in centers. And this is happening as early as 12, 13, 15, but we are seeing heightened abuse coming at around the ages of 17, 18, 19. I think this is when now they are starting to transit into adulthood, and they are not sure on how to handle some of these issues. I would say social media is one of the vices that we are actually working with. As we collect the data within the young people that visit, one of the things that comes out explicitly is online sexual exploitation of children. So I wouldn't run away from social media. It is good, but it's also creating a lot of issues with the young people that we face. Young people tell you some of the clients they get within the brothels or within the bars or in the spaces where they are sexually exploited. They get them from the online. They are no longer physically in the bars, but they have phones, they have WhatsApp groups, they have TikTok, they have lots of platforms, apps, Tumblr, where they go and access clientele. Now the parent is a little bit ignorant about the technology that is advancing at a very fast rate. It's a bit difficult to go to and talk to a parent of 60 years now and telling them about Snapchat. I was abused on Tumblr, because the young person is waking up in the morning and connecting with the online groups the parent doesn't know of. The parent does not even have a smartphone. So how will they know how to operate the smartphone or even support this young person who is already high up there? Now we have the AI platforms where people just get information in just a minute. They don't even need to talk to their parent. I know those days when for us we were growing up, when we needed advice, the first person you talked to was your parent. But the generation now, the first person they talk to is AI. I need help with my homework, I go to AI. So there's a grip there, there's a gap, a big gap there in parenting, but also the fact that the generations are changing at a very fast rate. Sometimes it's difficult for the parents to know how to deal with this particular parenting in a digital world. It was easier when we didn't have this internet or AI platforms. It was a lot easier to parent. But now, if you want to be a good parent, you have to know how to protect your child online, what platforms they are on. If they are not on those platforms, then where else are they getting support? Who are their friends? And now parents, it's more of, let me look for the money and survive. This is where now our community has taken us. This generation has taken us to survival mode. So if I don't have money, I will not survive. If I don't have money, my children will not go to school. So I need to look for the money and then pay less attention to safety and support of my children. Because I believe that when I have the money, I will still, prevent all these other issues happening. But it's not the case. We are finding children coming from very wealthy families and have been exploited online. They are the most exposed to online exploitation and violence. And it's a bit difficult where we are going, but I think one of the things that we can do is do more engagement with parents, ensure that parents have the right information, they get the right training they need to ensure that they protect their children and not just look at the money, but also look at this other arm of social protection. My last appeal to stakeholders is that they need to look at young people as beneficial, young people that also have competences and capacities to do better, not just let them rot because one has gone astray, has gotten pregnant, or has started their first bottles with alcohol or dealing with drugs, and they cannot come out of that. But I think one thing that we need to do is ensure that we are providing the right support to young people. We are understanding them better and meeting them where they are at. If they are on social media, can we be more innovative and get there? But also train ourselves to understand that platform and that intergenerational changes that are happening in their lives and support them at that development stage where they are at. UDEL has moved with quite a lot of partners in the last 32 years. We are very proud of our donors because UDEL's work is 99% donor dependent. We have worked with quite a number of donors. Some have come, some have gone, some are still with us for quite a long time, and we are very proud of that. I don't know if I should mention some of the donors. Yes, we've worked with quite a number of donors. We've worked with Icelandic Church Aid. UNICEF is currently supporting our programs on girls mentorship. Icelandic Church Aid and Lutheran World Federation are supporting our programs on economic empowerment and sexual reproductive health rights and information for young people. We've worked with Bread for the World, a German-based agency that is supporting our work on sexual reproductive health and economic empowerment. We've worked with philanthropists that are supporting economic empowerment and access to justice. We are part of various forums with ECPAT International. UNODC has played a very big role in supporting our programs on crime prevention, youth crime prevention, and violent extremism acts within young people and alcohol, drugs, and substance use. We've worked with CEDA that is supporting youth leadership and voices of change for young people. We've worked with quite a large platform. Government is coming in more, providing for us a safe place to work. When we have spaces where we need our voices to be heard, they've listened, they've heard. Some of the models that government is already doing have been gotten from the UDEL model, like the Presidential Skilling Program that started as a result of the UDEL's vocational skills learning that the government saw us doing and how the changes were happening with young people. So they adopted that. And then they've also played a complementary role where we do not have services, for example, health services, they provide that. They are very willing to partner with us and provide those services at no cost. And media like UBC, I mean, UBC is also a partner. You have amplified our voices, you have documented some of the successes that we've gotten, but you also keep listening in on when we do researches and studies and want to publish what is happening out there and getting people to understand issues around young people and how to manage young people. I think UBC and media have done a very great job, so thank you very much. We are located on Sapolo Kagwa Road, opposite Makerere Business Institute and Starbucks petrol station. You can contact us on websites, on our website, that is www.udel.org. You can also find us on various social media platforms, on X, on Facebook, on Instagram, on TikTok. We are using Uganda Youth Development Link as the key when you type in Uganda Youth Development Link or UDEL, you can access all those platforms as well. We are there, and you can send us a quick message and we'll definitely contact you. With direct contact with me, you can call my number, that is 0776 700 555. Thank you very much. God bless you too.
UBC, inspiring Uganda.
Every Wednesday, live in our studios in the heart of Kampala.
We have to